My name is Dodi Meyer. I'm a pediatrician. I work in primary care, but mostly now spend my time overseeing a large portfolio of community health programs at Columbia University and New York Presbyterian. I'm vice chair for community health for the Department of Pediatrics at Columbia University and medical director for community health for the Division of Community and Population Health at New York Presbyterian Hospital. I'm here today to honor the memory of my father, Rabbi Marshall T. Meyer, and share a little bit about the work that I do on food insecurity and honestly how it relates to his legacy in my own life. I was born, raised, and went to medical school in Buenos Aires, Argentina. My father, Rabbi Marshall T. Meyer, was a social activist, was a human rights activist, and he really did all this work from a very deep religious belief to answer to the question in the Bible, are we our brothers or sisters' keeper? And it was no question in his mind that the answer was an absolute yes. And that the answer to being in this world, or more than the answer, the calling of being in this world, is really to try to leave this world a little better than what we found. He believed in this with every fiber of his being, even when we were faced with a brutal military dictatorship in Argentina from 76 and 83. And he was one of few that fought the military dictatorship, even when he knew he was putting our lives in danger. So obviously, like I always say, I breastfed social justice, and there was no question in my mind that whatever I did with my life, social justice had to be included in my work. I didn't do it through human rights and through the politics of government, but I decided that I was going to do it through health. When I came here to do my training, it was obvious that I wanted to work with a Latino population, Spanish being my first language, and really, as I said, in working in primary care, I was felt very frustrated that we were only touching the tip of the iceberg, and I needed to go to the root causes of the diseases that I was seeing in practice. And the root causes were in the socioeconomic environment that these children were living. So inspired by the work of my father, I wanted to practice medicine through a social justice lens. When I started practicing pediatrics, I really was taken aback by the big gap that existed between the large amount of science generated in a medical center like Columbia University, New York Presbyterian Hospital, and how this message was being conveyed to the population we serve, with really not a very deep understanding of what their socioeconomic status was, what their lives were, what their cultural and health beliefs were, and how that advice could be congruent with people's lives. When asking patients about social determinants of health, we focus on the domains of food insecurity, housing quality and instability, transportation and utility needs, and in the case of pediatrics also, obviously, when we are dealing with infants with maternal depression and domestic violence. And over the years, the number one need of all our patients within these domains has been food insecurity. So that led us to understand that there's a lot that's going on in the home environment that has a direct impact on the growth and development of the child that we as pediatricians need to tackle. And that led me to try to understand what the food situation is in the communities that I serve, specifically in Washington Heights, understand the concept of food deserts, understand the concepts of poor access to healthy food, and obviously all the policies and entitlements that exist that lead to one of the richest countries in the world to have the degree of food insecurity that we have here in New York City. When my father came here to the United States and reinvigorated the Congregation B'nai Jeshurun, before he died, he was already talking about building an interfaith center in New York, truly believing that if we were going to tackle the issues that the city and the world were facing at that time, 30 years ago, his answer would be through dialogue and interfaith dialogue, communication, and activism. If you would only know what we're going through today, being able to be part of the Interfaith Center of New York Conference through this video, it really brings me to tears to know that some people here are willing and committed to talk across faiths to try to make this world a better place.